we know that there is a growing prescription digital therapeutic industry, and certainly prescription digital therapeutics, they have tremendous potential to help diagnose and treat important health conditions that affect patients both in the United States and worldwide, from insomnia to opioid use disorder, for example. And we know that they also have the potential to reach, so in addition to the industry growing, we know they have the potential to reach a large number of individuals. So we're very interested in this specific area. It's growing, it's important, lots of potential, in particular, for example, reaching individuals in rural areas. A new modality of treatment that can be combined with other therapies to hopefully improve the treatment, again, of things like insomnia, opioid use disorder, et cetera. But we, excuse me, to our knowledge, there's not been an evaluation of the clinical evidence supporting prescription digital therapeutics. Unlike for prescription drugs, there are lots of rigorous studies that have evaluated the quality of evidence supporting new drugs coming to the market. Similarly, new medical devices in my field of cardiovascular medicine studies looking at the quality of evidence. And so we wanted to know what is the quality of evidence supporting prescription digital therapeutics, and that was an important part of our research question. The other is the other sort of portion of our research question is, we also know that, again, these prescription digital therapeutics being developed, there's significant enthusiasm, but what patient populations are being studied? It's really important that prescription digital therapeutics, like any therapeutic or diagnostic, are studied in diverse representative patient populations, similar to those with that in routine clinical practice would be expected to get these would be expected to perhaps be prescribed these prescription digital therapeutics. And that was sort of the other piece of our question is, can we try to understand better the age, the sex, the race, the other requirements in evidence generation? We knew this was an important question, but you're right. Unlike the ability to, for example, for medical devices to go to the FDA's website, or for pre-market approval medical devices to click, and you can identify all of the original pre-market approval devices, you can limit to cardiovascular or general and plastic surgery. It's very easy to do. That's not possible for prescription digital therapeutics. And I agree that having a central repository of these that have FDA authorization, and using the word authorization because none of them in our study had FDA approval, that is pre-market approval. All of them were de novo or 510(k) clearance. I think that would be incredibly helpful. And I think that the whole field would rise together because that information would be more transparently available as to what prescription digital therapeutics have received FDA authorization, what are their different indications, and that would allow us then to better understand a lot of the questions that we've studied here. And it would also allow, as we know, we studied a total of 20. This is it's a burgeoning field that would allow in the future, it would make it easier to conduct similar work in, let's say, 2027, 2028. How far have we come where at a time point in which I'm sure there will be more prescription digital therapeutics on the United States market. So we limited to those that were that had received that were regulated by the FDA, that had received some FDA authorization, and that required a clinician's prescription for use. I think on the one hand, we might say we're looking at just a sliver of the wide array and growing array of digital therapeutics on the market. On the other hand, we would expect these to be the cream of the crop in terms of the quality of evidence, because these received FDA authorization. A clinician must prescribe them for use in clinical practice. In general, insurers, payers are also going to have more confidence if there's that stamp of FDA authorization. Clinicians are going to generally have more confidence if there's that stamp of FDA authorization. So this is as high as the evidence bar gets, in my opinion, as to what we're likely to see. And so that was part of the motivations. This is probably as good as it gets.